Hi, it's Andrew Gassman with PRMA. Welcome this afternoon. I just wanted to sit down and chat with all of you out there. Something that has been an evolution in our practice is how we address the donor site and improving the overall quality of the aesthetic outcome for our patients going through the reconstructive process. And we've come through to the evolution to the high-def DIEP. High-definition DIEP is essentially where we're trying to optimize the donor site and the aesthetic outcome of the breast as much as possible. To do this, we use a number of techniques that have come from the aesthetic world, in which we, through a better understanding of how we can use the original operation's donor site closure, as well as the techniques for liposuction and fat grafting in the revision procedures to yield an overall improved aesthetic contour. Happy to answer any questions that kind of come up today and go through them.
Okay, so we do have a question. It's, how does high-def DIEP Flap differ from regular DIEP Flap breast reconstruction?
It's a great question. So ultimately, the breast reconstruction itself is very similar. The tissue is elevated from the abdominal area and then brought up to the chest, connected with blood vessels and then nerves as well, if they're available. Where we start to differ is how we address the donor site. And in doing so, in the right patient, we're able to actually contour the abdominal wall so that the overall contour of the belly and hip area is greatly improved to give an overall much more athletic and toned appearance to the abdominal wall during the initial procedure. The differences begin to separate further when we get in the revision period and we're doing high volume liposuction. We can do further liposculpture of the abdominal wall and torso and posterior area to add additional fat graft to that reconstruction.
And what are the benefits of high-def DIEP?
Ultimately, the primary benefit is going to be an overall improved aesthetic contour and a much more athletic appearance to the patient. These give greater contour definition to the abdominal area, the six-pack area. Although we do not create an actual six-pack, the overall aesthetic contour appears much more toned abdominal area with greater definition of the patient's curves.
So what determines a candidate for the high-def DIEP?
So that comes down to the patient's overall anatomy and their health. So some patients have a very good relationship with their overall proportion, with their length of their torso and their width and how thick their abdominal wall is. And so in the process of closing, if we're able to put in sutures that allow us to shape, that can reveal those curves, then the patient would be a great candidate. It adds a very small amount of time to the overall operation, but I think all in all it yields an excellent result.
So what would be an acceptable BMI? What would be considered a good BMI for that? So
most patients that fall below, I would say 32 or less, would be considerable candidate, definitely below 30. But the sweet spot really falls into patients that are anywhere from 25 to 30. And more often than not, these are patients that are pretty athletic but have been trouble losing a little bit extra from their abdominal area anyway. These patients generally lean towards having tissue reconstruction because it solves many issues, but in this case, it really just adds the icing on the cake, if you will.
So there's
a couple of them for stage 2.
Let's see here. Does the scar line, does it kind of similar to the original DIEP? Is it different? How does that?
So the scar itself changes somewhat in the original operation. So part of how we do this operation is we're able to advance the abdominal wall closure a little bit further. And not only do we put in the sutures to help with the closure and push that scar just a little bit lower, those same sutures are the sutures that add additional definition to the abdominal wall. So the scar will lower. The overall shape of that scar may change as well, because the scar will bend in that lower position to actually also improve the hip contour and silhouette.
Got it.
Can I do one of those? So next question is, what is the role of body contouring in high def deep?
They're basically one and the same. So body contouring is a kind of bigger overall umbrella within plastic surgery, and high def deep is essentially where an intersection between high definition body contouring meets breast reconstruction with DIEP. Body contouring can extend much further into other areas and be much more involved, say in patients with massive weight loss and that sort of thing. But this is basically a great intersection of these two exciting areas of plastic surgery.
So there are some questions kind of just of general reconstruction, so we'll try to get to those at the end if there's some time, but I kind of want to go over some of the questions about the actual high def deep. So there is a question on there about are all patients able to receive the high definition deep, or I guess that kind of goes back to who's a candidate, but
yeah, I mean, this is basically on a case-by-case scenario, and that's a determination you'll make with your doctor. With the use of additional sutures, we want to make sure that the patient doesn't have any underlying additional wound healing risks and that sort of thing, but an otherwise healthy patient that has an appropriate BMI, this is a good alternative. But for those patients that maybe carry some additional risk factors for wound healing, this may not be ideal, and those would include potentially other things that would put even a DIEP at risk, which would include smoking, which is a general contraindication, elevated diabetes lab values, and other things like that. But this is really something that's customized and figured out on a case-by-case scenario between the physician and the patient.
So how does recovery time differ?
So the overall recovery is a little, is changed hardly at all. I mean, it's pretty much the same. It really comes down to a technique with the operation. I will say that patients do report a little more tightness in their abdominal wall as you'd expect, but that's part of how it works.
Yeah. What about insurance coverage? Is this insurance that covers a DIEP flap, is it going to differ from?
Fundamentally, there isn't much change in that regard. There's no additional charging at this point.
And there's another question. How many patients receive the high def compared to regular deep?
And that's basically determined on a as encountered basis, and that's something where I'll have a discussion with the patient and ask overall what their motivations are, and I don't know if I would say 50%, but a good number, and it just depends on the patient's overall body habitus and their stage of life, if that's something that they're interested in at that point.
So how does that affect stage 2? So typically you'll go in and do liposuction, fat grafting in stage 2. What can you expect from stage 2 after high def deep?
That's a great question. So I've been pleasantly surprised that actually doing these techniques on the front end has actually greatly improved some of the other issues we had to address in the second stage, like dog ears and that sort of thing, are either gone or much smaller. By no means can I guarantee that they're gone, but they definitely have improved. If the stage 2, in my mind, is something that's best used to improve elements within the breast itself, but we can use elements of these high definition liposuction and body sculpting when we go in to obtain fat graft for the breast itself. So It's something that helps set us up in the first stage, and then we can really get dramatic results by the end of the second.
Let's see. I know a hot topic, just kind of off high def deep a little bit, but a hot topic lately has been skin islands. Do skin islands play the same role with high def deep as they do a regular DIEP flap?
They do.
And what's the point, I guess? So I know I had a patient that asked why skin islands.
So the skin island is used predominantly as a means to help monitor the flap after we've transferred the tissue. The blood flow through the skin shows both good arterial and venous flow, which is critical to what we do. So that's a very natural and very important way in which we can monitor the quality of the vascular reconstruction of what we're doing. High def DIEP doesn't necessarily address that. It addresses and overall improves the contour of the donor site.
So one of the questions we're seeing a lot on here is if they've already had a stage 1, how does that affect if they want to do this high definition?
So that would be a discussion with the plastic surgeon to see if, one, the volume of fat graft that's required for the secondary procedure, and then when that fat graft is obtained, the total volume that's required, and where that will be taken from. And based on that, we can make decisions of the liposculpture that can be achieved.
So there's still lipo possibilities in stage 2 that if you didn't
For
have.
sure, for sure.
Did you have pictures you wanted to?
Oh, sure.
Share?
I can show you
Like
just some concepts. So here's an individual that was done, and we took the photo with the light coming from the side to basically help demonstrate the shadow of where we're getting some of the additional definition to the abdominal wall.
So right here, this shadow right here coming in. Perfect. Let's see what else.
And here's an individual.
You want to lock it?
Yeah, no, it's okay. Here's an individual at the start of their second stage where they still have skin islands.
There you go.
And we're able to get a significant amount of volume to change the overall breast contour with a considerable amount of fat.
Can you explain all what was done in that second stage?
So in this procedure, the skin islands were removed, the abdominal scar was revised only modestly because it was already fairly low, and then a substantial amount of fat was actually placed in each breast, and as a result, more volume was then retained. And then, for example, other areas of the donor site besides the abdominal area, at the start of the procedure from the...
So we're looking at the back side
So
here.
this is the back side, the flank and hip area that was later trimmed down to a much more narrow waistline.
Perfect. Let's see.
Another result, just some additional definition.
That was after.
Yeah, these
Immediately
are
after.
the stage 1. Yeah, there's just several more of these.
Let's see. Someone wants to know if you can chat really quick about nerve regeneration and lymph node transplant. So how does TruSense?
Okay.
If you can chat kind of quickly about while we're looking at other questions about just TruSense, what it is, and.
Sure. TruSense is where we obtain nerves from the abdominal wall. These are isolated while we're carefully sifting the blood vessel out from in between the muscle fibers of the abdominal wall. These nerves would have been cut otherwise if we either had an abdominoplasty or the tissue was just transferred anyway. We take additional time and gain additional length on it. And then once that tissue has been transferred to the chest, the nerve is then found adjacent to the blood vessel in the chest, and we make that connection. That connection will not be made if the position of the nerve from the abdominal area would lead to a kink in the blood vessel, because the priority there is the blood vessel over the nerve. But wherever possible, we obtain that nerve in the hopes that we can make that connection. Once that connection's made, it's then up to the patient's body to power up that connection, which can take several months, but it then goes from having no possibility of sensation to having the possibility of sensation.
So if someone had a mastectomy 15 years ago, they would still be a candidate for something like the high-def DIEP?
Potentially, yeah, because I mean, ultimately the important part and I guess the incremental change here is really the donor site. We've gotten very good over the years of creating a very aesthetic breast and having a good abdominal closure, but now we're progressing the donor site closure that much better and that much further.
So somebody was asking, how do you get rid of abdominal bloating, swelling post phase 2? So
there's many reasons for that. One of the possibilities could be fluid retained within the abdominal wall, in which lymphatic drainage could improve that. That can take some time. That can happen in forms of compression therapy, but otherwise, more often than not, lymphatic rerouting just takes a significant amount of time. Also, on a case-by-case scenario, sometimes depending on where the reconstruction was done, you just need to discuss with your clinician that there was truly a DIEP performed, because sometimes if there was muscle removed, that can lead to some abdominal discomfort.
Something I can actually answer here is Cindy is asking where to find our information on how to make an appointment. So Cindy, we do offer virtual consultations within our practice. You can just call the office, let them know if you're out of state or in state, and they'll get you connected with the right intake department, and they'll get you scheduled for a consultation. Our phone number at the office is 210-692-1181. That's all that I'm seeing coming through right now. Do you have any other comments or anything else?
No,
kind of covered a lot there,
yeah,
really quickly.
Yeah, that's great. I'm happy to provide the service and hopefully get to meet some of you
in person
soon enough, or virtually, however it works.
So obviously if there's any other questions, we'll kind of start signing off here, but if you have any other questions, you can leave them in the comments, and our team here will answer them as they come in. Otherwise, if there's no other questions, we'll go ahead and sign out here. And good? You good, Crystal? All right, bye guys, have a good night.